How to know if you're ready for a facelift. My name is Dr. Sanan. I'm a double board certified facial plastic surgeon practicing in Boston, Massachusetts. In this video today, I'm gonna describe when is the right time to do a facelift. My goal when I perform your facelift and neck lift is to make sure you don't look overdone, that you don't look over pulled. The goal here is to give you a natural refresh, for you to recognize a younger version of yourself, to feel when you look in the mirror, you see someone who's 10, 12 years younger, but you still recognize yourself. The goal here is to restore harmony, and you do that by making sure you lift things in the deep plane and set things back to where they used to be. A question many people have is, when do I know if non-surgical treatments are no longer enough for me? If you're finding yourself looking in the mirror at certain things, including the lack of jawline definition, the formation of jowls, looseness of your neck, skin, and muscle, or you feel like your brows are heavy, you've lost volume in certain areas, despite doing Botox, despite doing fillers, doing facials and lasers, it's time to start thinking about surgery. Surgery, in my opinion, resets the clock much more meaningfully and lasts longer than any non-surgical treatment. There is a role for non-surgical treatments, however, you have to be real with yourself. One of the realities is that non-surgical treatments do not lift the face and neck. If you have meaningful laxity of your jawline and neckline resulting in jowls or loss of neck definition, no non-surgical treatment will restore that contour for you. This is where surgery comes into play. When people hear about the idea of surgery, it can certainly be a very daunting word to hear. However, if your goal is to look natural and a refreshed, rested version of yourself, you have to understand putting things back to where they used to be with surgery is much more natural than any non-surgical treatment. One of the first questions people ask is, am I the right age for surgery? And this is very much so a hotly debated topic. There's no quote-unquote ideal age for a facelift. However, in my experience, if you're noticing signs of aging, meaning jowls, meaning looseness along your jawline, meaning loss of neckline definition, and you're considering doing surgery, that's the right time for you. It could be as early as somebody in their 40s, 50s, 60s onwards. In my experience as a plastic surgeon, the younger you do the operation, the shorter your downtime, the quicker you're healing, the better your scars, and the more meaningful of a result you have. And this is because the younger you do it, your skin has an inherent elasticity to it. The way it heals is much faster than if you have lost the elasticity. The skin has a couple key components, including collagen, elastin, and hyaluronic acid. These three things tend to deteriorate with time. So if you do your surgery in your 40s, your result will be much more long-lasting and meaningful compared to someone who does it in their 60s. That being said, it's a very personal decision. People have to take time off from their work and their social lives. They have to take time off for their personal lives to recover from the operation. So it comes down to when you have 2 weeks that you can recover, when you look in the mirror or photos, you're really bothered by certain things, that's when you should start entertaining the idea of surgery. So how do I evaluate somebody for a facelift, neck lift, or full facial rejuvenation surgery? When you submit an inquiry through my website or my social media, my coordinator does a whole screening process where we do a photo review. We'll review your photos and objectively see, are there things we can improve surgically for you? When you meet me in person, I'll learn about your goals. I'll learn about what bothers you. We'll look at your photos together. You may feel that you're starting to loosen up, but if objectively I can't make things that much better, or you don't have as much laxity as you think you do, I'll tell you to wait. I'll tell you to wait till you age a little bit before undergoing surgery under the knife. You may still be a better candidate for non-surgical treatments. We're very honest in our consultations, and our patients very, very much so appreciate this. Now, if you have enough laxity where you've started to develop looseness of the cheek area, you've got jowls, you've lost your jawline and neckline definition, your brows are heavy, I'll go through the whole consultation process talking about the different surgeries you're a candidate for. I'm a big believer of a natural reset. You have to assess somebody from their brows down to their neck. If you only fix the jowls and the neck, but you don't address laxity in the upper part of the face, there's a disconnect, and that can lead someone to looking unnatural. If you lift the brows, reset some of the eyelid skin redundancy, and address the face and the neck with a deep plane facelift neck lift, a person looks like a natural, younger, refreshed version of themselves. So in closing, how do you know if you're a candidate for a facelift and neck lift? First and foremost, this is a very personal decision. The timing is going to be when it's the right time for you. You could be in your 40s, your 50s, 60s, and older. But when you feel that you're bothered by the way you look in pictures or in the mirror, it's time to have a discussion with a board certified facial plastic surgeon. As I said earlier, the right time to do it if you're considering surgery, younger is better. Your skin has more elasticity, it has more collagen, more elastin, therefore your incisions will heal faster, your recovery will be shorter compared to someone who has older skin or much more advanced aging. I find somewhere in people in their mid to late 40s or early 50s who undergo their first deep plane facelift and neck lift, they age tremendously differently than someone who hasn't undergone surgery in that age group. This is because you're starting to notice changes in your skin laxity and your muscle laxity, and if you do a full facial rejuvenation surgery, your aging pathway is very different than if you don't do anything. That being said, I've done plenty of surgery on patients who are 65 plus, who are in their 70s, who have very heavy jowls, very heavy neck looseness, and I do the operation, they recognize a younger version of themselves, and they sometimes even say that their jawline, neckline is better than they've ever remembered it being. So the short of it is, it's a very personal decision. I'll talk to you about what I can improve objectively very thoroughly in your consultation. And if you're considering a facelift and a neck lift or full facial rejuvenation operation, do your research, make sure you see a double board certified facial plastic surgeon, and I look forward to meeting you. If you enjoyed this video, please like it and subscribe to my channel. Thank you.